All right, turning now to the latest headlines around COVID-19. The Biden administration extending its COVID-19 emergency declaration, citing the spread of more transmissible variants. Joining us now with more is Yahoo Finance's Anjalee Khemlani. Anjalee, what's the latest?
That's right, Rochelle. We've got the 12th extension of the public health emergency by the health department. Secretary Javier Becerra saying today that this is going to be extended for another 90 days. That is the duration of the public health emergency. And this is, of course, we know because of the variants that are at play out there, keeping an eye on what the government can do. As you see on your screen, this is the number of times in the past that the public health emergency has been extended. The health department did promise states that they would give them a 60-day notice when they intend on ending it. So what that means is next month is where we should really be keeping an eye, because there have been rumors that the public health emergency could end by this April. I know that industry insiders have been talking about that month for quite some time, since last year, to be honest. And so we might be nearing that end of the public health emergency. This also comes into play as we talk about the cost of vaccines. We know that the vaccine companies are setting their prices as they expect to enter the commercial market sometime this year. So all the pieces of the puzzle starting to come together here.
We'll be keeping an eye on that date. And Anjalee, we also received new details on the Inflation Reduction Act timeline for lowering the pricing of some drugs and medications. What's the latest there?
That's right. So if you recall, the Inflation Reduction Act was passed with the intention of starting with 10 drugs and negotiating those prices through Medicare, and that is for Medicare Part D. The first date that is important to remember is September of this year. That's where they're going to identify the first 10. Then by next September, they're going to have the prices negotiated to go into effect by January of 2026. That date was known. We did know that these prices were going to start to go into effect there, but it's important to keep an eye on, because this starts that process that many have been excited about in terms of, capping spend, especially for Medicare, where we know it's one of the biggest revenue sources for these companies. Now, in other parts of the Inflation Reduction Act have already been put in place, including the capping of insulin prices, including, watching the price increase of certain drugs for Part D and Part B by last year and this year. So all of that really starting to come together. But this really big part, the more interesting part, which is for the first time the government being able to negotiate prices, that's starting to come together. And so this is the first look at the timeline, and more details to come.
We'll definitely be keeping an eye on what we're seeing with those. I know it'll be welcome news for a lot of consumers out there, with times already being quite tough. Anjalee Khemlani there.